Hi, I am Salyana, the Self-Care Alchemist, and in this video, I will discuss stroke, the silent killer. A stroke occurs when blood flow is restricted in the brain. This restriction prevents the brain from receiving the necessary oxygen and nutrients. Consequently, brain cells begin to die, causing long-term damage, disability, or death. It should be noted that a stroke can be triggered by bleeding in the brain. Did you know that in the U.S., every 40 seconds, someone has a stroke? Also, stroke is the leading cause of death in men, and 4 out of 5 cases of stroke are preventable. There are a number of factors that increase the risk of having a stroke. Those factors include having high blood pressure, having high cholesterol levels, smoking, being obese, having diabetes, and being physically inactive. You can identify a stroke as it occurs by acting fast. F.A.S.T. F stands for facial drooping. Facial muscles will become weak and begin to droop when someone suffers a stroke. The blood flow blockage causes nerve damage within the brain, so one or both sides of the face may become numb. Facial paralysis can be tested by smiling in a mirror. If one side of the face does not lift, that means that the person may be experiencing facial paralysis. Act fast. A stands for arm weakness. One or both arms may become weak, or the person may feel a sensation in their arm. There may be some arm mobility or no movement at all. Test for arm weakness or paralysis by raising both arms for a few seconds. The inability to raise arms or having them drift downward may indicate weakness. Act fast. S stands for speech difficulties, slurred speech, and speech difficulties are signs of a stroke. The brain controls the larynx and vocal cords, so nerve damage in the brain will affect the ability to speak. Test speech by speaking a few sentences aloud in the mirror or to another person. Ask the person to repeat what was said. Act fast. T stands for time to call for emergency services. Call 911 as soon as possible in the event one or more of the stroke symptoms are being experienced. Every minute counts when blood flow is restricted in the brain. Do not drive to the hospital. Call for an ambulance. There are several ways to prevent or reduce the risk of having a stroke. First, eat healthy meals high in fiber. These meals should include fruits and vegetables. Maintain a healthy weight. Participate in regular physical activity for at least 30 minutes per day. Limit alcohol consumption. Control blood pressure and diabetes. Check cholesterol levels, and quit smoking or do not smoke. Pepper Pulse Tincture is a natural energizer that can help support your circulatory and digestive systems. Its key ingredient, cayenne pepper, is known for its ability to improve blood flow. However, it's important to consult with a healthcare professional before using Pepper Pulse Tincture, especially if you have any existing health conditions or you're taking medications. To learn more about Pepper Pulse Tincture and other Salyana Essentials products, visit SalyanaEssentials.com. That is stroke in a nutshell. Thank you for watching. You can check out other videos at Salyana Essentials on YouTube, and you can follow us on Instagram at Salyana Essentials as well. I am Selena, the Self-Care Alchemist, and here's to optimal health.